There was an interesting study that was recently published that found that people who suffer with allergies have a 66% increased risk of developing some forms of mental illness, primarily depression and anxiety.
It's a big number.
It's a big number. So it begs the question, why, right? So what we think is going on is we think it has to do with the inflammation that results when you're having allergies. So there's more and more data that keeps coming out over the years that is showing that mental illness, particularly depression, but also anxiety, has an inflammatory component. And this can actually be measured in the blood. So you can see that people's inflammatory reactors are up in their blood. And so anything that ends up causing increases in inflammation in your body can negatively impact your mental health.
And you are seeing this. You're seeing that people are having a more tough time emotionally during the season.
It's absolutely the real deal. I mean, it's really fascinating when I saw this study, because I've suspected that maybe there was an inflammatory component, but this was really sort of validating for me. I have seen consistently year after year, this time of year is a traditionally difficult time of year for a lot of people. And in fact, March, April, May traditionally have the highest rates of suicide of all the months. And it's actually the same when you look at the Southern Hemisphere. Their version of spring also has the highest rates of suicide. So I think that this is definitely one of the contributing factors to some of that.
So if you know that you can measure this inflammation, what can you do to combat it, knowing that this is happening right now in this allergy season?
So I do a couple things with my patients. One thing is I will ask them if they're having a particularly tough time this year, do you have allergies? Some of them will say, oh yeah, they've been really bad, or yeah, they're a little bit mild. I'll ask if they take anything. If they don't, I am recommending that they take something over the counter for their allergies. The other thing is, if you start to know somebody over time, you recognize that traditionally they'll start to have a difficult time this time of year. So if they're on medication, I will proactively change or increase their dose of medicine to protect them from having some sort of worsening of their condition during this time of year. They're on that higher dose for a few months, and then they go back down to their normal dose for the rest of the year.
Allergists do that too, like get ahead of it in February. Do anti-inflammatory medications such as aspirin or ibuprofen work for this sort of thing too?
Well, so there was no data specifically looking for allergies with this, but there is data showing that if somebody has depression and if they have elevated levels of inflammation, that if you give them things like aspirin or ibuprofen, it will help increase the rates of response to the antidepressants, and it will also speed their response to the antidepressant treatment. So again, it's just fascinating because it's showing that there is this inflammatory component going on. So anything that you could do to decrease inflammation, whether it's taking anti-inflammatories or allergy medicine or focusing on your gut health, probiotics, making sure you cut down on sugar because that's pro-inflammatory. Sleep and exercise are also anti-inflammatory. So anything to decrease the inflammatory load in your body is going to have a beneficial impact on your mental health.
Wow, really interesting connections.
Fascinating.
Yeah, Dr. Joshua Weiner, thanks as always.
My
Appreciate
pleasure.
it.